Hi everybody, good evening, how are you? I'm here with Rachel Goulet.
Hi.
Hey! So we're here for Wellness Wednesday, and I'm very excited about this particular session. This is session number 2, and this is going to be a good one. And the reason why is because this is going to be relevant to you or someone you know who could use the benefit of receiving osteopathic treatments for the benefits it can provide for their body. Hello, Crystal. How are you? It looks like I got something sticking out of my head there. Let me see. What do you think? I'll go over here a bit. Rachel, if you want to scoot over here just a little bit towards me. We're going to get cozy. Sorry. I told you we might have to move around a bit and just find that sweet spot. So there we are. Crystal, can you hear us well? Give us a thumbs up or something. We'd really
Hi,
appreciate
Crystal.
it. Do you know Crystal?
I don't know Crystal.
No, you need to meet her. She's amazing. So today we're going to talk about osteopathy. And Rachel, you brought something tonight.
Yes, I did.
Okay, tell us what you brought. I'm so excited.
I brought, for those of you who engage with us tonight, 1 hour osteopathic treatment complimentary. So drop a hi or a question. We might not address the questions tonight. I'll personally message you. But yeah, for anyone who says hello.
Or ask, or even if they ask a question during it, and like you say, you'll answer later. So no, I love that. That's great. And wow, guys. Okay, so once you hear what osteopathy is all about, you're definitely, if you listen to the end, you'll be like, okay, I gotta put a hi or something there. So actually, we're gonna get right into what that is very shortly. Now, when I would go to see an osteopathic manual practitioner, I would just say an osteopath. You can't really say that though, right?
Yeah, so there's a distinction between an osteopath and an osteopathic manual practitioner. An osteopath is a protected title which is given to a medical doctor who specializes in osteopathy. An osteopathic manual practitioner, as we're called in Canada, we just treat with using manual therapy.
Okay, awesome. Thank you. And so, but for now on, I'm going to refer to you as an osteopath, just for the short term. Okay, thank you. Thank you, Anne. And guess what, Anne? You are in for a gift certificate, 1 hour possibly. There's going to be a draw for that. So thank you for your interaction. If you have any questions, for any of you even on the replay, if you have a question, please post it because Rachel is just a wealth of information. How long have you been doing osteopathy, first of all?
So I graduated in 2010, so almost 8 years.
8 years, okay. And how long did you go to school for?
The program is 7 years, so it's 5 years in class, and then 2 years to write a thesis.
Wow. Okay, and I have Catherine on here right now. Catherine, my old massage therapist buddy, back from the school, London. We used to go to the Darcy Lane Institute. Hello, how are you? So this girl went to school a lot longer than we did, Catherine. Didn't we find our program was heavy duty? Hi, Kelly. How are you as well? So we're going to talk about osteopathy. Why don't we get right into it? What do you treat? What does an osteopath treat?
All right. So we treat low back pain, neck pain, headaches, migraines. If you've suffered a concussion, we treat a lot of similar things that you would go to see your massage therapist or chiropractor or physiotherapist. We also treat sinusitis, jaw pain, tinnitus.
So like whole TMJ, right? That whole, okay,
Yep.
Hi, Daniel.
I also treat scar tissue. And if you suffer from chronic pain or acute pain, you could seek out an osteopathic practitioner for that.
Okay, and when you talk about, the things that osteopathy treats is unbelievable. And I know for me, it really helped with my panic attacks that I had from a motor vehicle accident, and also in the anxiety attacks and whiplash, really bad whiplash. I did massage therapy, I did chiropractic and physio, and they're all wonderful modalities. And I used to be an RMT, I believe in massage therapy. But oftentimes, many times, and would you agree with this, you're the last person on the road that people want to come in see for a treatment.
Yes, that's true. It's very common to hear from people that, one, that they've never heard of osteopathy, and two, that they've tried all these other modalities, and they're at a loss to find a way to, find a solution to their pain or getting rid of their pain.
Okay, and we're going to talk a bit more about what you do specifically, what a treatment is like. So for all of you, stick around. It's going to be amazing. Anne, look at Anne really wants in on this gift certificate. I tell you, that's it. Awesome. Anne, it could be you. She asked about fibromyalgia.
Yes, I have patients with fibromyalgia.
Okay, great.
So it's about pain management. It's not necessarily that we eliminate pain, but we can help reduce it and help you manage with it.
Okay. And I know when I would leave from a osteopath treatment, I sometimes would feel a little bit sore after, and it was interesting because it's such a beautiful light manipulation of the tissues. It feels like your hands are just kind of laying on me, and you can fall asleep during a treatment oftentimes. And then I'm like, wow, she really worked on me. I felt it the next day. But it wasn't a bad feeling. It was good. It felt like that individual worked on me. Yeah. So that's because you're really manipulating things, aren't you?
Yeah, we're making changes in the body. And it's the same as if you had gone and worked out, or you hadn't worked out for a while, and then you go and do a workout. You feel it the next day. This is something new for your body. And everybody's body responds differently. So some people do report that they are a bit sore after a treatment, even though I think what's remarkable, what you just said, is that you didn't do a lot of aggressive movements.
Right.
I wasn't digging into your trapezius, or I wasn't...
Which is these muscles here, guys.
Yeah.
Most people know what a trapezius is nowadays, right?
So,
but yeah, so the shoulder muscles or wherever it is, right?
Right, and it's, very gentle, and yet it still can have a pretty big impact on the body.
Absolutely. Hi, Tamara. How are you as well? Oh my gosh, all these wonderful people here with us. This is great. A lot of people are just so interested in this. Now, question for you. What age do you treat people with osteopathy?
Great question.
Okay.
So any age can benefit from osteopathy. You can be treated as a newborn and...
So a newborn, a little baby.
Yes.
Okay. Actually, I already know the answer to that one. Sorry, guys.
Absolutely.
I saw an osteopath in Toronto because we didn't have osteopaths around this area at one point that I was aware of. I had to go to Toronto to see somebody. And I was being trained a little bit in a part of osteopathy, okay? But this isn't about me. But what happened is the little baby was really crying. And he put his hands on that baby so gently, and the baby just stopped. And it was amazing. This baby was screaming and everything, and I'm like, wow, what special powers does he have? Yeah. But he was gently manipulating, what would you say, the rhythm of the baby's fluids?
Yeah, the cerebral spinal fluid with cranial work is affected by that kind of treatment. So,
okay. So up more at the skull area for the baby.
Yes.
Yeah. So we wore a path in the tiles here, guys, with our fella Liam. So I think he could have used maybe some osteopathy. So, but
it's great.
Here.
It's great for colic or breastfeeding challenges, digestive issues. What else? Sleep disturbances.
And how about organs? You were talking about organs with me there. What's the whole organ thing about? So we're talking liver and spleen and whatever, lungs, for asthma, I suppose.
Absolutely.
Okay, yeah.
So osteopathy, I think one of the sort of differentiating from chiropractic, massage, physio, and other manual therapy is the fact that we do treat organs. So we're able to feel if an organ is shifted out of alignment, everything rotates around a specific axis. If it is off its axis, then we can help direct it back to where it needs to be. If there's compression or congestion in an organ, you can imagine that would alter its function. And so therefore, in restoring its mobility, you help with its function, and then you have an improvement. If it's the liver, then you have an improvement in liver function, kidney function.
Wow.
And these organs, they obviously sit within us, and they have an effect. If your organ is not moving well, then the structure around it will start to adapt to the fact that organ isn't moving correctly.
So then so basically, if I could paraphrase, you're bringing it back to a balance, to a physiological balance. So it works more optimally.
Yes.
Right? It functions at a more optimal level. And guys, she doesn't get her hands into your abdomen and start moving those things around. It's just incredible, the very subtle techniques that you can use to achieve so much. So it's awesome. Tamara said hello. Tamara, you're in for the gift certificate draw. Yay. 1 hour, guys. So listen, Kathy, hello, how are you? Please, guys, comment, say hello if you have a question about would osteopathy treat X, Y, Z. Please comment. And Rachel might even be able to answer here live or on the replay. Okay? So, question for you. Do any of you know what osteopathy is?
We got right into it.
Right. I have a question here because I have a couple of notes, guys, because you don't want to forget things. So I said, do any of you know what osteopathy is? Well, I think we kind of answered that more or less, right?
Bit,
so
yeah.
It's a little bit,
but I wouldn't mind adding.
Could you add something? Because, my idea is it's like peeling layers of an onion skin, like layers of an onion, right? To get to the core. So I come to Rachel, guys, and I'm like, oh my, Rachel, I have such a sore neck, and I'm having all these headaches. And Rachel, you start working on my lower back. Or maybe it's my leg. Yeah. Why? Why are you doing that? Okay.
Well, first of all, as you can assume from what we've discussed, osteopathy is a manual therapy. It's a hands-on treatment, but we take a holistic approach. So we look at the whole body. So you come in with a specific symptom, such as a headache, but I'm going to look at your feet, I'm going to look at your posture, I'm going to look at your pelvis, your spine, because all of it can be feeding into what's creating the symptom.
Okay. So do you find that sometimes a person's having headaches, but you have to go and deal with, it could be a number of treatments till you finally uncover that it's a head issue, but it started with the hip. Yeah. And you had to correct the hip, then you had to correct something in the spine, then okay, now we're getting to the neck. Right. So there's a real flow to things that way.
It's systematic, and each person is different. So two people can both come in with the symptom of headaches, right? But I may take a different approach for each person, and that's what's beautiful about it is that it's very specific to you. It's not a generic treatment. I don't have a recipe. Every treatment and each time you come in, it's very different. That's what's wonderful about osteopathy, because we really get to know your body. And we also believe and uphold that when the body's in balance, and that's why we look at everything, when the body is in balance, it is naturally able to take care of itself, heal itself.
So you're facilitating the healing. Yes. You're opening the floodgates to allow the body to heal itself.
Exactly.
You just are kind of coaxing it along.
Exactly.
Okay. Yeah. Tweaking here and there. I love this. Okay. Hi, Denise. How are you? Denise commented, 1 hour osteopath treatment. Sorry to keep doing this. Greg, hey, your biggest fan is here. Hi, Greg, how are you? So we covered a lot of things. We could just do a quick little recap again. What are some things that osteopathy would treat? Sure. And then let's talk about walking into your treatment room and what happens so people don't feel so foreign to how that works.
Okay, so just a recap. Osteopathy can treat low back pain, neck pain, pretty much any spinal pain, any joint pain, for instance, knees, knee, ankle. I treat people who have had concussions, who have digestive problems, sinusitis.
How about allergies? Sorry to interrupt. How about allergies?
So that's a really great question.
Okay.
So sometimes with looking at food allergies, I may look at the digestive system and make sure that the nerve supply to the digestive system is intact. So, and then I might look at specific organs. The liver is a big one, stomach, the coils of the intestine. So these are all things that can support people who are kind of investigating whether or not they have allergies.
Okay, all right, this is great. Wow. Awesome. Oh, we have Steffi here asking some questions. She's my osteopath and a miracle worker. I love it, Steffi. Oh, wow. If it's not too personal, you would like to share, Steffi, what Rachel was helping you with, maybe someone else in the audience can identify. Hello, Tammy. How are you as well? Everyone that comments, you have an opportunity to get 1 hour with Rachel. So I'm going to make sure I comment later so I get in on the draw too. So I want to see her. Just kidding. So now scar tissue as well. I've had 3 times where they've cut my abdomen, 2 C-sections, and my endometriosis. I mean, you can take care of my scar area. And why? Why would you? Okay. So it looks better?
No, it has nothing to do with appearance. Well, I mean,
it could, I suppose.
If it was, puckered or a little. It depends on the extent. But,
okay.
The goal isn't about the aesthetics, but it's more about the function. So when you have a scar, it's pathological. You can never restore that tissue back to the way it was.
Okay.
However, well, firstly, the scar itself will pull the tissue around, surrounding tissue into it, so it becomes a place of fixation.
Right.
And so what we do is we can go in layer by layer and break up that scar tissue so that we can give the best chance for that tissue to function.
Okay.
So we're gonna peel away as much as we can from it, and it's a passion of mine, scar tissue, because I did my thesis on it, and I actually wanted to share my story because it is about scar tissue.
Would you like to?
Yeah.
Please, yes, and then we'll get into the treatment aspect of what a treatment's all about. Go ahead.
So
Luke says hi, by the way.
Hi, Luke.
All right, go ahead.
So when I was in school, I think it was the third year, we had our founder of our school who was doing an extra course, and he was going to demonstrate in front of the class a technique, an osteoarticular or a structural technique for the upper back. Mm-hmm. And so what happened was, usually when the instructor wants a volunteer, everyone races to be the first one on the table, because you can get an instructor's hands on you, it's the best.
It's gold.
Yes.
Remember, she was a massage therapist at one time, like I was, and what did we do? We always me, like everyone's putting up their hands. Like, I want to be the So go ahead.
Yeah. So then so we're all waiting, and he points right at me.
Oh, he did?
He picked me out.
Why?
Of a class. I don't know. So,
okay.
So I was like, okay, I'll come back.
Right, yeah.
Sure. So he wanted to demonstrate this this correction. And before he did it, he honed in on my scar. Now, he speaks French. He's a translator. Okay. Never asked me a question. Pulled me up.
Okay.
Goes right to my scar. Releases the scar.
Like, what do you mean? Like, bam?
Yeah, he did a little bit of an impulse while he released it.
Okay.
And
I'm sorry, I have to ask it. Did he go
So his hands were on my. So I had
like that.
I had a certain.
Yeah.
So he just kind of impulsed on the scar, and and what he didn't know is that at that time I was trying to get pregnant, and I had been trying for many months and was unsuccessful. Okay. After that correction, the next month I got pregnant.
Really? Mm-hmm. Now, and what do you feel is a correlation to that?
Well,
what are the scar? Because you think
the scar tissue itself was because of an abdominal surgery I had when I was 14 on an ovary. Okay. And so he released it. It changed my cycle.
Come on.
Yeah. So it was.
Actually, that doesn't surprise me. Yeah. I mean, it's amazing and you're the last on the road. Guys, we go to all these different caregivers, and aren't we so blessed to have so many to choose from? But it's all right, I tried everything else, I'll go to the osteopath. Yeah. And oftentimes you can really be that answer for them. That's beautiful. I love it. Hello, Denise. Oh, someone was asking, Tammy was asking, where's your office located? It is in St. Catharines at Own. We're going to cover that more at the end. But Optimal Wellness Niagara. Okay, so, and it's Rachel Goulet. So they'll be able to Google you and find you there, sure.
Oh yeah, we'll put a link.
We'll put a link for sure. We're going to type it in there, guys. Okay, so scar tissue. That is a really awesome story. I love it. Very good. Let's see.
Get your scars treated.
Get your scars treated.
It might be the reason you have shoulder pain, neck pain.
For myself, I get a lot of bloating. Yeah, and that could be because of something going on from the scars. Okay, all right. I need to see you. Okay. So I come to your office. Yes. And I booked an appointment. I can come for a half hour or an hour, I guess, generally speaking. Yep. But the first treatment is about an hour.
It's an hour.
Okay. Because of assessment. So much like when you go to see anyone, guys, right? You have that assessment time. Yeah. Now, do I take my clothes off and lay down on a table? What happens?
No. So
I know what happens, but I want. Yeah. Okay.
So you come comfortable. The same thing you'd wear to the gym, or yoga, or Pilates. Okay. Same thing.
All right. So comfortable clothing that you can palpate through a bit as well, right? Don't wear a bulky sweater.
Jeans, they're not...
Even jeans.
Jeans are too...
They're too much. Yeah. Okay, that's what I thought. Okay, very good. And then I remember sitting on the edge of the table and looking at the spine and looking at the shoulders. You're really doing an assessment visually.
Yes. So there'll be a postural assessment.
Postural.
There'll be orthopedic tests. So I'll look at how the spine is moving, how the pelvis is moving, how the neck is moving.
Okay.
So that all takes time. The first treatment, it's a lot of dialogue about your history. There's a 5-page health history that you fill out.
Okay.
And so it's very thorough. I want to know everything about you, everything that's happened since you were a child. Want to know it all.
So so even like I'd say if someone fell off their bike.
Absolutely.
Right? Anything. Yep. Yeah, because that's having an impact on the body.
Yep.
And can be causing those fixated areas as you spoke about earlier, right?
Exactly.
So we need to release that. So, okay. And then I'm like, so someone is, Denise, who's on here. Denise is laying on your table and she has some comfortable clothes on. You come in, you start to just place your hands gently on the person, I suppose, and...
Yeah, so we have a variety of techniques or tools that we use. Some of them look like chiropractic.
Okay.
Some of them are positioning the body and using an isometric or a static contraction of a muscle to help reset or rebalance a joint.
So you're talking about like kind of like Karen, tense up your thigh muscle.
Yeah,
and
like
then
press
pushing
against my hand.
it, right?
Okay, so I'll rotate you a certain way and then get you to push your head against my hand or push your leg against my hand.
Right.
So you'll meet my resistance. Some of it is just gentle, hands-on. You will think that I am doing nothing, but I am doing something. But it will feel like...
it won't feel like much at the time.
It won't necessarily feel like much. And then... what else? Yeah, I think that's great. That's great. And you say it could be a half hour or an hour depending, right? Yes. So, and how much is it for an osteopath treatment? Yes.
Because people are going to want to know.
So for 1 hour it's $95.
Okay.
And for half an hour it's $60.
Okay. And to me, it's priceless what you offer. Because, not really, honestly, you can't put a price tag on it, because if you're going to get that relief you've been really looking for, and it could be the answer for you, I mean, that's just worth every penny. And would you say that a person, like I know in massage therapy, we'd say, by about the 3rd to 5th treatment, you should know if massage therapy is helping, say, with your headaches?
Yes.
Would that be similar to, say, with osteopathy, or?
Definitely, yes. Yeah.
Okay.
So usually, it's not uncommon that you notice something right away.
Okay.
But it can take a couple of treatments for the symptom that you're specifically looking at to resolve.
Okay.
So, and it depends, because some people who have had long-standing or multiple injuries, like it all plays a role.
How many years, right?
Yeah, and how many years it's been there and how many injuries you've incurred is going to determine, the length of time.
The length of time, yeah. And if it's a structural thing, like bone-wise, sometimes you can't change the bone structure, but you can help manipulate things around, right? To bring the pain relief.
Yeah, we're trying to gain as much mobility as we can.
I love it. Awesome. Okay. All right. And are you covered under insurance?
Yes.
Okay.
Yes.
All right. I love it. So that's great too. So there you go. I paid a lot out of pocket, but if I had to go twice and it took care of what I needed, and my husband, he commented that, hello, Deborah, and hello, Megan. Thank you for joining us. He said it was the only thing that helped with his shoulder. He suffered so bad with his shoulder, and and that's gonna, just the value alone in getting the relief you need, so you can get back to work, to get back to your job,
going for a walk,
going
back to the gym, doing whatever you love to do. I think that's what's so rewarding, is that with any modality or therapy that you choose, it's the value is just even doing the simple things in life, walking without pain. People who have foot pain, like, being able to go for a walk is important.
That's hugely important, yeah.
You take it for granted when you don't have pain, but...
Oh, how true is that?
Yeah.
That's for sure. So I think that would bring us right around to the question of, what do you love most about your profession? I mean, it sounds like you love helping people. Absolutely. And I know you well. Yeah. I know this I've known you for how long now? I mean, I was an RMT for 18 years, and I've been 4 or 5 years now. I've been retired, and you and I, we were massage therapy buddies.
Yes.
And then I remember you studying, and I swear it was like, what is she studying here? Are you going to be a neuroscientist? Like, I could not get over. I was just looking, and I'm like, that sounds really interesting, but I don't know if Karen Head could do that. So I'm glad you took it. I'm glad you did it. It's awesome. Okay, so any questions, please go ahead and ask everyone if you'd like. I mean, we have a bit of time here. What are we looking at? We're going to round up very soon. And I just want to take a look at my notes. Let me see. Just want to go here too and take a look at what people have been asking. So we got where's the office? Luke said hello. Great info. Thank you, Tammy. She needs to book an appointment, Denise. Okay, God love it. God love her. Okay, even my honey's watching. Okay, so so osteopathy covers a lot of things. And do you work with other healthcare professionals? Are you able to work in okay?
Yeah, so I work at Optimal Wellness Niagara at 26 Hiscott Street here in St. Catharines near the Wildfire restaurant on Ontario Street. And I work with amazing colleagues. We have a naturopath, Dr. Stephen Tripodi.
Oh, he's awesome.
We now have 2 massage therapists.
Oh, you do?
Yeah.
Because Beth Elliott, I love her.
Yes.
Oh, Cooper. I shouldn't have said that. I mean, somebody else. Oh, Beth Cooper. I always do that to her every time.
Do you?
Oh, she just loves it.
That?
So, yes, everyone see who else I said there. I don't want everyone to go to my Beth. I call her my Beth. She's amazing. So,
she is awesome.
Yeah, anyhow, go ahead.
Yeah, Richard Alfett just started with us. He's another massage therapist who offers acupuncture. We have a medical esthetician. We offer, we have a psychotherapist, reflexology, Reiki, vibrational therapy, and we actually have a money coach.
A money coach as well. There you go. Wow. It's all part of wellness, isn't it? Yeah.
Yeah, you've got to take care of
stress management.
Yeah.
Right?
It is. And we have a movement studio that offers Pilates and yoga. And I know there's some other things. I think we even had swing dancing at one point.
Swing dancing?
Yeah.
Oh, wow.
And we offer workshops on occasion as well. So.
Okay. Great to know.
It's a one-stop shop.
One-stop shop. I love it. I love it. And it's called OWN. So again, it's Optimal Wellness Niagara, OWN, and is in Nancy, and it's 26 Hiscott. And I guess there'd be a website then as well, right?
Yeah, we can put that in there.
Yeah? Okay, we'll put that in the comments for all of you. And I think we've covered everything. I'd hate to leave you all because then I'd be like, oh, shoot, I should have mentioned or I should have asked. Is there anything you can think of at all, Rachel, that we haven't spoken about? So what is osteopathy? What it treats? Kind of what a treatment's all about. I think we've done it. So, yeah.
There's maybe just 1 or 2 things that just came to mind.
Yeah, go ahead.
I also work with women who are pregnant. And as we mentioned, with children, babies, I treat babies as well. And I forgot to mention that difficult deliveries, babies who have had difficult deliveries would hugely benefit from osteopathic treatment, specifically cranial work.
Okay, and is that because too, like I know we spoke a bit about the forceps and whatnot, right? And different way that child is birthed as well. There's different because the bones can be a bit say compressed or
so what happens when you get born, the bones actually telescope or they like fold in on each other, and then they expand as they come out. But sometimes what can happen if you've had a prolonged labor, then those bones can get stuck, or if you've had to have suction or forceps, then the baby's head, the bones get compressed even more, which makes them more vulnerable to being stuck.
Okay, and just to touch on this, because just so you all know, if you've ever been in science lab and you see Mr. Skeleton off to the side, right? But it just looks like this one uniform bone, like skull. But you have these sutures, right? And so, like, the cerebral spinal fluid, it goes over your brain, down your spine, over your brain, much like a heartbeat, much like respiration, we have that flow of the cerebral spinal fluid. Absolutely. So you have those bones are always at a pulse like that, right? So you're saying the baby's bones could get a bit jammed, a bit stuck. The fluid's not flowing as well. It's compromising something, or physiologically, again, like we said, you don't have that balance, right? That your body's working at an optimal level, and I think that would be touching, like say on colic. Colic has a lot to do with the digestive system, right?
Absolutely,
And what are some of the most common treatments requested for you? From you in regards to babies, would it be colic? Would it be colic or sleeping issues? Or
I think all of those, sleeping, even developmental milestones sometimes, like if a baby isn't rolling over, or digestive is huge.
Okay.
Reflux.
Reflux.
Yes.
Oh, and that's one I don't think. Did you mention that one? Because reflux,
even in adults, that's.
I had the regurgitation and with the acid, and I think I saw. Oh, was it you? Might have been you. I'm trying to seen a couple
I know, that's
osteopaths,
okay.
right?
That's
So,
great.
I probably couldn't get in with you because you're so popular. But they just kind of pulled or something.
Yeah.
And took care of it.
Yes.
And I'm like, what?
Yep.
Yeah, so I love it. Okay, so hello, Brian. How are you as well?
Hey,
and Steffi said, I love them. There's so many services. Yes, absolutely. Well, listen, everyone, please mark replay if you're joining us after this viewing. And we thank you so much. There's Jeanette. By the way, I wanted to ask you also quickly, I know we really got to get going here, but MS, Lyme disease, these type of things also?
Yeah, again, it's about managing symptoms.
Okay.
So, I have patients who have MS and Lyme disease and fibromyalgia.
And fibromyalgia.
So chronic